Welcome to RSSDI. I am Dr. Sanjay Kamble, and on behalf of RSSDI TV 2020 brought to you by Wockhardt, I welcome you all. I am glad to have with us today a renowned diabetologist from Amritsar, Dr. Rohit Kapoor. Dr. Kapoor is the medical director, care, Heart and Super Specialty Hospital, Amritsar. Welcome, Dr. Kapoor, to the show.
Hi, good afternoon to
Sir,
everybody.
based on your recent talk in RSSDI, we would like to know what is gut microbiota? What is gut microbiota?
So this is something very important and latest about the role of gut microbiota in this world now. It's just only the few years back, Sanjay, this concept of gut microbiota has come. So gut microbiota is the normal gut bacteria which we are having inside our gut since infancy, since the birth of the child, the bacteria grows in our intestine. And as the time grows, as the age grows, and the bacteria changes from infancy to childhood to adulthood and the old age. And this gut bacteria is very, very important, which 60 to 70% is a special, that is Formicutis bacteria. 30% they are actinobacter, 10% and 20% is bacteroides. There are three groups, they are very, very important. So this gut microbiota is very important to keep our body healthy. So now the concept is this: if we keep these gut microbials or these gut bacteria and well planned, and they should not be disturbed, and then I think the body will remain healthy. Because in the many researches it has come to know now the changes in the gut microbiota or this composition of this gut bacteria is responsible for many diseases like diabetes, atherosclerosis, multiple sclerosis, colonic cancers, inflammatory bowel disease, even inflammatory bowel syndrome. So like this, there are many diseases which are responsible. Even the mood changes and behavioral disturbances, they are linked with the changes in the gut microbiota. So this gut microbiota is very important. You can imagine, Sanjay, we are having trillions of bacteria inside our body, and which is more than our even cells of the body. And the weight is 1.5 kg. They contribute to the body system. So this is gut microbiota.
Okay. What is the role of probiotics in diabetes?
So that's very important because now this gut microbiota changing composition has been responsible for development of insulin resistance. These gut bacteria, if we take, there are a lot of researches which has told us now in the last few years, if we take a very high fat diet, very low fiber diet, what happens? That disturbs the gut bacteria. These gut bacteria, when it is disturbed, because they are responsible for maintaining the intestinal permeability. Now, when this gut bacteria or microbiota is disturbed, the intestinal permeability is disturbed. So what is happening? There is a one point called lipopolysaccharide, which is secreted from the wall of this gram-negative bacteria, and they go to the circulation and they cause endotoxemia. This metabolic endotoxemia, it leads to insulin resistance through the various mechanisms, which I am difficult to tell here, which I've already told in my lecture, how it causes insulin resistance. And you know, one of the pathogenic mechanism of type 2 diabetes is insulin resistance. But definitely, I tell you, even there are many research papers which has told us even the role of gut microbiota in type 1 diabetes also. So role of probiotics, in which what we do, we give the live these microorganisms, these bacteria, to the body system. These bacteria, when we give live as ingested purpose, like immunes is available, which is the latest, having multiple strains of this bacteria microbiota, what they get, they maintain the intestinal permeability, they lower the insulin resistance, and they control even the fasting sugar and even A1C. So many papers now they confirmed it that probiotics, they are helpful in even prevention of diabetes. In some pre-diabetes population, it has been given. Even when we have started a trial on the pre-diabetes population in Indian population, that how it prevents development of the diabetes. And very much I am hopeful and very aggressive to understand that in the next 2 years of this study, which is going to tell us, and it is going to change the scenario, how the pre-diabetes population can be prevented from development of diabetes only with the administration and addition of probiotics to our treatment.
Okay. So, sir, what do you recommend about probiotics in diabetes patients?
No, because then Sanjay, now because I said lot of data is with me now. It's not a small data. The lot of data is very authenticated and confident data that administration of probiotics is going to help in the treatment of diabetes now. Now it has become an adjunct treatment, whatever OAD or insulin you are using. Now the many papers now they are there, which I've already mentioned in my paper when I gave my lecture on the gut microbiota to day before yesterday, that there are a lot of papers I mentioned which has proven that addition of probiotics as an adjunct treatment to the diabetes treatment, it is definitely going to control your A1C far better, fasting blood sugar far better, and even controlling the HOMA IR model, which is indirectly linked with this insulin resistance. So when we are having so much of authenticated data and all these papers mentioning that probiotics are going to help us, so I recommend from my side that every diabetic should be added probiotics. That is very important. And however, we have to choose the probiotic. Like we are having immunes now. Immunes is a very important probiotic which is having multiple special species of microbiomes in that. So we have to choose that probiotic which is not a single strain microorganism. It should be a multiple strain microorganisms, and specifically it should contain bifido, yeah, lacto, or whatever. So we have to see the composition, and definitely it is going to help treatment in even type 2, even in type 1 also. So my recommendation, even you are having type 1 diabetes children on insulin, if you're going to add this probiotics, that is going to help in the treatment of both type 2 and type 1 diabetics.
Thank you, sir, for sharing your views, and stay tuned to RSSDI TV 2020 for more recent updates from RSS. Thank you
Thank
so
you
much.
very much. Really thanks.